I'd like to thank the moderators and sages for the privilege of the podium. And we're going to hit a little bit on social media, and in particular, here it is. These are my disclosures, none of which are relevant to my discussion today. SAGES has, as you may well know, multiple 8, now 9 closed social media groups that are sponsored by the organization and utilized to varying degrees. And so part of the SAGES plan for the rollout of these groups was to also not only support them in that they are valuable to the contributors and the participants from an educational and quality assurance metric, but also to create a task force around them to better ensure that we're utilizing them safely and responsibly. So the Facebook group task force was created essentially to address the value of these SAGES-sponsored closed social media groups, establish a position on how we can use them safely by ensuring patient advocacy, surgeon protection, and informed consent, and then try to create some materials that users of these groups could employ at their health systems or hospitals in a template form to make it easier to comply. So this isn't really for reading, it's essentially the literature review. The point here is that the literature on this particular topic is very sparse, so there wasn't a great deal of information for the task force to go and utilize. We did our best to compile it, and one of the things we did in addition to literature review was to go to some exemplary programs who had rolled out a sort of patient advocate informed consent policy document, as well as separate informed consents for posting to social media when protected health information is included. And these two sites were those where we got some exemplary information. But then ultimately what we did was in the form of a committee and then ultimately endorsed by SAGES Executive Council and the board was to not only demonstrate that these closed social media groups sponsored by SAGES were for education, and I think if anyone has used them, you can certainly learn from them, but also for quality improvement. And if they are considered a metric for education and quality improvement, then they should also be protected from discoverability, much like your morbidity or mortality conference or any other quality assurance conference is. Protecting it from discoverability not only assures quality discussions, but may also foster medical legal protection for those who are posting within these groups. So to that end, the task force and ultimately SAGES felt that there should be a public disclaimer on these social media groups, which there are, to demonstrate to the end user or the poster how they should comply and how they should behave, if you will, when using these closed social media groups. And as a part of that disclaimer is also the fact that SAGES endorses the use of an informed consent policy and document separate from what you might use for the operating room to promote transparency and patient autonomy, but also reiterate the point that the poster is the one responsible for deciding and obtaining that informed consent from the patient, including that informed consent in the electronic health record, and also within the post documenting that they have some written informed consent in order to imply or in order to ensure that they are, if you will, medical legally protected. This is one example disclaimer. You can clearly see this is far too long to include in every single post. That's not the point. These types of disclaimers are within the homepage, if you will, of the closed social media groups to inform the posters of what is the appropriate sort of behavior when utilizing these groups and the appropriate way to protect themselves from a medical legal standpoint. An informed consent is as exactly what you think it is. It's not rocket science, but it is the fact that it may be a change in your behavior when approaching patients in the clinic or in the perioperative environment to obtain separate consent outside of that for your procedure. And so what we ultimately did was we wanted to make that easy for everyone, or easier for everyone. And so the task force, again, after literature review and review of exemplary policies, tried to come up with a way that we could facilitate the dissemination of information through closed social media groups for peer review and education, i.e. quality assurance, have it apply to everybody in the workforce, most of the time surgeons in this case, and instruct them on the best procedures for posting to these groups. And so that's what we tried to do and ultimately published recently in Surgical Endoscopy, so you can obtain all this information there. But the idea was to take these patient documents and informed consents that are very specific to the use of closed social media groups. And they include things that we all see on those groups. So that's postings, that's video, that's audio, anything with potential protected health information. And you can simply include a brief statement that informs the readers of any post that you have obtained written consent from the patient regarding that post. And then you obviously have to have obtained that informed consent and include it in the electronic health record from a medical legal standpoint. Sorry, wrong direction. So all of the things that we use in posts, like clinical photographs, videos, audio recordings, those are all permitted, of course, that are de-identified, protected health information. And it's useful for the diagnosis, care, and treatment of these patients. But it's also really about ensuring education and quality improvement because, again, if we want to protect it from discoverability, we must treat it like a quality assurance program. And that's essentially what it's very useful for. There are some caveats within the policy, like the fact that you probably can't record things on your personal iPhone 10 and walk around with them, which shouldn't surprise anyone. But there are hospital and practice-owned pieces of equipment or cell phones or other ways to obtain video according to the policy, again, to protect the poster as well as to advocate for the patients. We finalized, passed through legal, and then had endorsed by the SAGE's Executive Council some language for an informed consent document. The idea here was to make this as easy as possible for the end users of these closed social media groups to take to their hospitals, health systems, and risk management. You can tweak this language as needed. It's, again, essentially a template. But if you obtain this separate from your OR posting, have it scanned or put into your electronic health record, if it's not already done electronically, and simply write in a post that you obtained written informed consent, that's far more patient advocacy and far more medical legal protection than we currently have when posting de-identified protected health information to social media groups. And so that's one of the reasons that SAGE has helped endorse this concept. So in summary, again, SAGE endorses the safe use of these platforms, which are designed to help improve quality outcomes for the purpose of CME and QI. It's the surgeon's responsibility to identify when that consent should be obtained and ultimately obtain that consent, and that the use of this consent policy and template may be helpful for the end user, both from a patient standpoint and a surgeon standpoint. So I'm happy to obtain or ask questions or address any questions. Thank you so much.
Thank you.